Do we ever imagine a simple walk or a small movement of one's finger can bring a smile on our face? There are millions of people who don't have the luxury to move their fingers, their arms, their legs. Do we connect with these people? Can they ever feel what these people feel or go through? Some people certainly can. What started as a result of an effort to understand the feeling of a patient who couldn't understand his own existence later became a dream, and finally the same dream transformed into Neurogen. The view or dogma regarding the brain as a programmed and static functionary is undergoing rapid changes. Now it is viewed as being dynamic and active, a supremely efficient adaptive system geared for evolution and change, ceaselessly adapting to the needs of the organism, its need, above all, to construct a coherent self and world, whatever defects or disorders of brain function befell it. Diseases, defects, disorders can play a paradoxical role by bringing out latent powers. This sense of the brain's remarkable plasticity, its capacity for the most striking adaptations, not least in the special and often desperate circumstances of neural or sensory mishap, assisted by stem cell therapy, is worth acknowledging. This film is a narrative of some such tales of survival under altered, sometimes radically altered conditions, survival made possible by the powers of regenerative medicine that is more popularly understood and related to as stem cell therapy. Omkar is a 4-year-old cerebral palsy child who has suffered a damage to certain parts of his brain due to lack of glucose immediately after his birth. The parts of the brain damaged are required for perception of vision, sounds and responding to them. He is self-absorbed. Since he is unable to hear or see, his other faculties, that is speech, had also not developed. Also, awareness about his surroundings, response to his surrounding stimulus is almost non-existent. When given a ball to play, he doesn't know what to do with it and keeps on tapping it with his hands. On being made to stand, he keeps on rotating in circles around himself since he has no sense of direction. He has episodes of mouth breathing since he has nothing to distract or involve him.
ज्या वेळेला तो झाला त्यावेळेला नॉर्मल होता, व्यवस्थित रडला वगैरे सगळं झालं होतं. पण चौथ्या दिवशी त्याचं तो डिहायड्रेट झाला, दूध प्यायला नाही अंगावर म्हणून. शुगर डाऊन आल्यानंतर त्याला आकडी यायला सुरुवात झाली. तिथे 10 दिवस ॲडमिट होता. त्यानंतर व्यवस्थित बरा झाला. पण 8व्या महिन्यामध्ये आमच्या असं लक्षात आलं की अजून हा मुलगा पालथा का पडत नाही, बघत नव्हता. मात्र म्हणजे असं डोळे वगैरे चांगले होते, त्याचे छान होते. पण आपण टाळ्या वगैरे वाजवल्यानं हसवतो ना मुलांना, तसं हसेना. झोपून उठला की दचकायचा. म्हणून एपिलेप्सीचा प्रॉब्लेम सुरू झाल्यानंतर त्याला औषध वगैरे झाल्यानंतर एक 5-6 महिने तो प्रॉब्लेम चालूच होता. मग नंतर त्याला मात्र बंद झालं. मी हरणार नाही. मी काही ना काय प्रयत्न करत राहणार. मी आयुर्वेदिक औषधं केली, होमिओपॅथी केली, अनेक डॉक्टरांना दाखवलं, पण तरी मी अजून प्रयत्न सोडणार नाही. हे मला कळल्यानंतर हेही केलं आणि कुणी काही सांगितलं तरी मी करीन. पैशाने पण करीन आणि जे कमावलं ते मला त्यातलं काय नको. हा मुलगा चांगला.
Gautam, a 31-year-old version of Omkar, he also had to suffer lack of oxygen during around birth. Here, however, the defect is different, and hence he has different affection. Gautam has a very endearing character about him. That is, he's a very cheerful person and extremely smart in remembering phone numbers. His speech is severely affected, and so is his walking.
When he was born, he didn't cry much. On third day evening, he became little blue, means he could not breathe, and because of lack of oxygen, he turned blue because he was just 3 days old baby.
असं होल्ड कर.
सांगा तुम्ही काय काय
आता सांगा
गौतम लोल्या लोल्या.
सांगा.
Hands. Then saliva
What
is-
Gautam's mother expects is not really the sky. All she wants is that Gautam should be able to speak, have a coherent conversation with other people, and be able to walk. Is it too much for a mother to expect? Can we give her any hope?
See, trying is my duty, getting is my luck.
बोल तोंडाने बोला.
Kartiki is a 22-year-old young girl, vibrant, full of life. Who would have ever thought that one fateful day, her life would come to a screeching halt?
Near about Manor and Charuti, there was a turning. I was the one who was driving the car. So at that turning, actually, I also don't know what happened. The car got skid. Or I just lost control. We got down. I saw first Kartiki lying at her side nearby a stone. My younger brother Rahul lying nearby that. We were just too scared and we couldn't find even Anisha. We just actually had forgotten about her. When we saw both of them, Rahul was just bleeding like anything and Kartiki was shouting like, it's paining, it's paining. All of a sudden Anisha also came. We were all scared of other people on the highway, stopped their car, they were coming and all. Then there was another guy who came by, his car was empty. I think he was a localite nearby only. He took us all of us in the car, took us to the hospital nearby. Over there we went, while we were on the way, I got my network, called up my uncle.
5:15 बजे फ़ोन आया जिसने एक्सीडेंट देखा उसका कि आपका लड़के लोग का कार का एक्सीडेंट हो गया है, सब बच्चे को लग गया है, अब फटाफट आ जाओ मनोर से 8 किलोमीटर लंबा है. मैं बोला मैं ट्राई हॉस्पिटल में लेने की जाने को डॉक्यूमेंट आप हॉस्पिटल में लेके जाओ, मैं पहुंचता हूँ 1-1.5 घंटे में.
जब भी हिंदुजा में लेके गए तभी पहले से हम लोग ने 1-2 जन को फ़ोन करके रखा था कि हम लोग हिंदुजा में आ रहे हैं, कोई अच्छे डॉक्टर का ये करके रखो करके. तो फिर उधर ही हम लोग को मीर बापट मिल गया, तुरंत ही मिल गया और तुरंत बोल दिया. उसने MRI सब निकाला और बोला कि ऐसा ऐसा है उसको कि अभी वो पूरा उसका स्पाइनल कॉर्ड क्रश हो गया. अभी कभी भी लाइफ में कभी भी वो चल नहीं सकेगी, उसको कुछ भी नहीं कर सकेगी. जो कुछ करने का है उसको व्हीलचेयर पे बैठ के ही पूरी लाइफ करना पड़ेगा.
Her spinal cord was badly damaged and she was left completely paralyzed waist down. Omkar, Gautam, Kartiki. All of these kids have little in common, except that they were all searching for hope. A hope for a better life. In case of Gautam and Omkar, something which they had never seen. In case of Kartiki, something which is still vivid in her dreams. Neurogen Brain and Spine Institute, which epitomizes regeneration and resurrection. And hope is the silver lining in lives of all of them and many, many such people. Neurogen offers the frontline therapy which incorporates regenerative medicine, that is, stem cell therapy, to remedy the disorders afflicting the brain and spinal cord. Regenerative medicine holds great hope for millions of patients with degenerative diseases and injuries. Repair of damaged organs and tissues following acute or chronic tissue injury using stem cells could potentially address the needs of these patients. Now this therapy is being used for spinal cord injuries, brain strokes, multiple sclerosis, ataxia, incoordination, muscular dystrophies, post-infective conditions of the brain and spinal cord, and many more such conditions where both patients and doctors had given up hope due to lack of any other therapy. Neurogen offers a neuro-regenerative rehabilitation therapy that involves the use of adult stem cells derived from the patient's own bone marrow, along with an aggressive rehabilitation program. The patient is admitted on Monday and undergoes detailed evaluation by our team of specialist medical doctors and therapists. On Tuesday, they undergo stem cell therapy. The procedure for this is as follows. Patient in supine position, local anesthesia is given in region of the anterior superior iliac spine, following which using a bone marrow aspiration needle. 100 ml of bone marrow is aspirated and collected in heparinized tubes and transported to the laboratory. In the neural tissue culture laboratory, the stem cells, MNCs, are separated. The cells are transported back to the OT in a sterile, cool container. The patient is put in a lateral or sitting position and using a lumbar puncture needle and CSF drainage set, the thecal sac punctured in the L4-L5 space. CSF obtained is then sent for examination. A catheter introduced into the thecal sac and the cells injected through the catheter. The catheter is withdrawn after the cells are injected. The patient then undergoes intensive rehabilitation therapy. Rehabilitation is an integrated approach which aims to make a disabled person into a differently abled person. And to accomplish this, they have a team comprising of physiotherapists, occupational therapists, speech therapists, urologists, neurophysicians, and a neuropsychologist. The program also consists of a creative visualization workshop which involves a group therapy where the patients are motivated to realize and bring out their own inner strengths. It helps understand how using one's mind power and positive energy a person can achieve goals which may otherwise be perceived as unachievable. Aaron, who is now 4 years old, had an abscess over his spine soon after his birth. The abscess was operated upon and removed when he was just 3 weeks old. Since then, there had been negligible movement in his lower limbs, and he could neither crawl nor walk. He has also had urinary incontinence, with drop-wise dribbling of urine. He could not feel any sensations in the lower part of the body. Next day, after the stem cell therapy, his flow of urine has improved. He is also able to appreciate hot and cold sensations. He has started gaining power in his legs and his trunk muscles. He is now able to sit in a children's car and drive it. Small joys in a child's life. He has now started taking steps on his own with calipers and a walker. Now, Aaron has a whole life filled with possibilities to look forward to. Pooja is a bubbly young girl full of life in spite of her multiple sclerosis. Apart from sharing a common birthday, Neurogen and Pooja also share a bond of hope and positivity with each other.
Now I've got a better control on my bladder, a good control on my bladder now. I've got control on my arms and all. Now I am being able to make those movements which I was not doing earlier. I was not being able to eat my food myself. Now it's getting easier, I am able to hold the cup, anything, any cup of tea or water.
Aruna had suffered brain damage due to brain fever almost 2 decades back.
She had no coordination in her hands and leg movements.
My memory is blocked.
After this thing, I feel there is some change. Like while lying on the bed, she can sit up pretty much easily. It wasn't possible earlier, but now she can at least make an effort. Halfway up, she can come.
Ibrahim has type of a spinal cord injury due to a fluid-filled cavity called as the syringomyelia. This injury started almost 25 years back and has gradually led to deterioration, so much so that he is now completely wheelchair-bound.
My respiratory system was affected actually.
Oh, I see.
And that was causing me that I couldn't breathe air inside, so I couldn't get it out, so I couldn't speak properly. But since the stem cell therapy, my lung power has increased, so I can speak in a proper way. I don't think this will improve my health altogether, or I can walk, I can run. But considering what I had lost, everything, in that case, if I'm getting something back, it is worth it. हम लोग once a week यहाँ आ रहे हैं, थोड़े दूसरे लोगों को भी देखते हैं, तो that also helps.
Here is Manjula Ghoshar, in whom parts of the brain responsible for recent or short-term memory and coordinated activities like walking, cooking, and other routine activities has degenerated.
चलने में जो स्टेप सामने सामने रखती थी वो स्टेप आगे पीछे रखने और दो पैर के बीच का डिस्टेंस बहुत कम हो गया है. जो चेंजेस में लास्ट 5-6 बरस में देखनी है वो चेंजेस अभी देखने मिलते हैं.
Within a few days after stem cell therapy, Omkar and Gautam have already started showing encouraging results. Omkar has started responding to stimulus, may it be tactile, that is touch, or audio, like his mother and granny calling out to him. Now he plays with the ball, which he earlier used to just tap on. Gautam's speech is becoming clearer, and his muscles too seem to be responding to active stimuli.
Just now he had this chapati. He could pick up little vegetable. Earlier he was only dipping it.
Okay.
Saliva, that is reduced a lot. Yesterday it didn't come at all. Today in between came, but not in that way the whole it was coming.
असं लगेच असं वाकून उभं राहायचं, तो जरा ताट उभं राहतो. हां. थोडं स्ट्रेट वाटतं ना, असं थोडं असं असेल तर असं. गती थोडंसं चालून दाखव.
As for Kartiki, it's time now for her to get back to life. With a little help from all quarters, stem cells, rehabilitation, family, and her own motivation, Kartiki is back on her feet. She is relearning to help herself become independent. She is now out and about, raring to move ahead, and is already back to work. As if she had just gone away on a holiday for a few months.